Hi, my name is Ahmed Soliman. I am director of the Voice, Airway, and Swallowing Center here at Temple. I am an otolaryngologist, and more specifically, I have additional training in laryngology or voice disorders. I, of course, do the full gamut of voice, airway, and swallowing disorders, but really airway disorders are my passion. We've done over 500 procedures over the past 20 years. Voice problems affect patients of all ages, usually for different reasons. So, younger patients might have more likely to get a hemorrhage, a bleed into one of their vocal folds from maybe screaming, or get nodules. As you get older, you're more likely to have, when you're in 60s, 70s, 80s, you'll have aging-related changes of the vocal folds. So they get thinner, much like all the muscles in our bodies will tend to get thinner. The vocal folds themselves also have muscles within them that'll get thin with age and can kind of give a gravelly, soft quality to the voice. So someone should see a voice, airway, and swallowing specialist if they have symptoms that are not improving or are worsening after, a week or two. Once you've reached that point and things aren't better, I think it's a good idea to be evaluated by somebody who specializes in this area. Airway stenosis affects people of all ages, but there's one particular type, the idiopathic type, also known, idiopathic meaning that there's no known cause for it, tends to affect women in their middle age. So that's a group that has to be particularly on the lookout, because if they're making noisy breathing, they're feeling short of breath, they're having difficulty, passing air, and are not improving with inhalers, then they need to come in and be evaluated because they may have this problem. Patients with airway stenosis are evaluated in the office. Once the diagnosis is confirmed, they're treated in the operating room. Usually we start a treatment endoscopically, meaning that we're working through the mouth, using laryngoscopes and bronchoscopes, which are long instruments that we're able to insert and place into the voice box, into the windpipe. There we use a variety of tools. Often we use the laser to make cuts in the area that's narrow, to widen it, and then we'll use a variety of dilating balloons to stretch it also. So at the end of the procedure, the patient wakes up and already are breathing considerably better. We observe them in the intensive care unit, usually overnight, and if everything goes well, as it almost always does, they go home the following morning.